Thank you. Can you hear me in the back okay with the mobile mic? Okay. I think you probably could anyway. Thanks. As you mentioned, I used to have something to do with CUPAs. The last time I did anything with CUPAs was over 10 years ago, and matter of fact, there was a Y2K exercise to ensure that there weren't going to be any incidents resulting from processes that had computer chips in them. Y2K, of course, was a non-event. I think at least part of that was due to the fact that everybody was so diligent in making sure that all the facilities were up to speed. I'm going to talk about, as I said, this report that we developed. I'm with the EPA Office of the Inspector General. I'll talk about that in a little more detail in a minute. And the title is EPA in Action in Identifying Hazardous Waste Pharmaceuticals May Result in Unsafe Disposal. That's a report. In the information online for the conference, there's the URL. The address is at the bottom. Feel free to download it. I'm just putting this up here. This is within the report, and a lot of OIG reports, it's available separately as well. Just a one-page summary of all our reports. You can always see it, so it's a good summary, good way to actually make your way through a lot of our reports. What I'm going to do is talk a little bit about OIG, who we are and what we do. Talk about the pharmaceutical waste report, what we did, why we did it, what the results were. And then, depending on time, take a little break, and then come back and talk about additional detail on related topics, including EPA classification of hazardous waste. I don't know if any of you were on the classification class yesterday or session yesterday. I'm not going to go into much level of detail, just talk about the listing process for pharmaceuticals. And Diana Peebler has volunteered to be available to give a California perspective on that as well, which is was a little different than other states, and I may touch on states like Minnesota as well and what they do. Also give a little bit of detail on finding toxicity information on pharmaceuticals. Additional information on the OIG I probably won't go into, but may give some information on potentially regulated facilities that you may or may not be aware of in your CUPAs. Office of the Inspector General. We're an independent office with an EPA, helps the agency protect the environment in a more efficient and cost-effective manner. Normally associate the OIG with audits, which are typically waste, fraud, and abuse, or inefficiencies or wasting of program money, especially with regarding contracts. We consist of auditors, program analysts, investigators, and others with extensive expertise in various program areas, including environmental program areas. The important point is our funding is separate from the agency, which ensures our independence. So what we say in our reports, we don't have to worry about pleasing the people that are going to give us the money to keep going. And the IGs in all federal agencies were created by federal statute. The reason I'm going into this, I think it's important to know in terms of the light of the report, how we work, what we do. We perform audits, evaluations, and investigations of EPA and its contractors. The title in the program talks about an investigation. It's not an investigation, it's an evaluation. An investigation normally implies a criminal investigation where we're concerned. We do these to promote economy and efficiency, and again, magic words, prevent, detect fraud, waste, and abuse. We provide hotline services, so anybody can make a complaint via hotline, by calling us up, by mail, by email, and they actually can be anonymous and certainly have been. We also meet with EPA and Congress as occasionally, periodically. EPA certainly quite a bit, and Congress depends on their request. This is the hotline. If any of you are interested, we receive complaints of waste, fraud, and abuse. If there's an issue with EPA you'd like to report, feel free. Mission, like everybody else, we've got a mission and goals. Promote economy, efficiency, effectiveness, help prevent and detect fraud, waste, and abuse, there we are again, through independent oversight of the programs and operations of EPA. Independent oversight is an issue. When we make our recommendations from our reports, which EPA has to respond to, we make our recommendations in the reports. We will typically make a recommendation saying that they should do something. We normally steer clear of telling them how to do it, because if we tell them how to, we might make suggestions and say, for example, you could, but if we tell them how to do it, then we're starting to have a role in program management, and that actually impairs our independence. Goals: treating customers and stakeholders with fairness, respect, and dignity, individual organizational excellence, competent, innovative, diverse, and dedicated workforce. This is our organization. Don't have a pointer, but Inspector General is Arthur Elkins. He's been with us several years. Under him, there's the Deputy and Chief of Staff and the Counsel's Office. And under that, there are our own program offices. There's audit, which again is primarily the fiscal audits, congressional and public affairs, which is performs a liaison function, cyber investigations and homeland security, which looks at potential intrusion in the EPA systems, investigations, which is criminal investigation, involving EPA employees or against EPA. Mission systems, which is our own internal IT operations, and then program evaluation. That's highlighted that in red because that's the organization I work in. Program evaluation is structured similar to EPA in the media programs: air, water, land, special products, and then there's enforcement and research are normally either integrated into those or they're integrated into one, depending upon how we're organized, which, like everybody else, changes all the time. When we do projects, again, program evaluation, so what we do is we evaluate EPA programs to see how they're doing. We make recommendations to state if they're not doing what they should be doing, and make recommendations for how they could be doing it better, and they're obligated to respond. We have to adhere to government auditing standards. Even though what we do is evaluations, which is not a financial audit, we still adhere to the standards, and some of those details are specified in our own internal project management handbook, and there's actually another book that we have to adhere to. It's called the Yellow Book, which is generally accepted government accounting standards. We have agreements with EPA on how we perform our work, how it's monitored, how it's reported. We perform our work in stages. Work can come in several ways. Congress can request it. We can get a hotline request, and that starts a project off. Most of our projects, I would say, especially our evaluations, come from our own planning process. People recommend, or managers become aware of an area that we should look at, and then those are suggested, and some of those make it through to be planned for a project in the next year. Initially, so we decide what we think a project should entail, and we define its scope, and then we go into a preliminary research phase for about 90 days. And after that length of time, we talk to EPA and whoever else we need to. If we decide there's something there, we either go straight to report writing, we go to field work, and then we go to report writing. When we decide what we're going to say, we meet with the EPA and talk about it and get some of their feedback from them. We get a draft report produced. When we produce a draft report, EPA has 30 days to respond. They respond formally, and we then respond to their comments and publish a final report. We have the last say in terms of their comments. We have in the past, and we did with this report, published EPA's technical comments, but I think that's going to stop, and we're going to primarily report just the comments on the recommendations. Technical reports on this report, on the pharmaceutical waste report, were about as long as the report itself. We had 44 technical comments, and we responded to each one of them. We produce recommendations from our reports. They have to have milestone dates from EPA, and then EPA tracks their performance. If EPA doesn't agree with the recommendation, mechanisms exist for audit resolution. And for EPA's completion of recommendations, there is a compendium of unimplemented recommendations reported to Congress every 6 months. Recommendations for which corrective actions haven't been completed as scheduled. The EPA normally doesn't want to be on that report. Another thing just to note, in terms of the way we write our reports, which seems like it should be a minor thing, but it's not. It takes a while. Because we adhere to auditing standards, we have a specified format we have to go into. I think everybody in here has probably written a report at some time with references. The way we reference a report, this is internally, every single sentence in the report has to have a reference. After the people write the report with complete references, documented in work papers that are going to stay around for a long time, then the project manager has to review and sign off on every single index to see that it's appropriate. And then the person above them has to sign off on it, at least on some of them, they spot check. And then we actually have a separate internal referencer that again takes a look at our references to make sure they're okay. So we go through a lot to get a report out and make sure that everything is factual. Our information is based on our own analysis, any evidence we gather, as well as interviews with EPA, states, locals. Every IG on a regular basis, it's either 2 or 3 years, is peer reviewed by other IGs, and they look at such things as are your reports appropriately indexed. The OIG website, which is www.epa.gov/OIG. Documents, starts, recommendation, completion dates, anything about our reports. Okay. On the pharmaceutical waste report, here's what I'm going to do. I'll give a quick report summary, purpose and questions addressed, background, scope and methodology, our findings, and our recommendations. If you have any questions at any time, raise your hand. If I don't see you, yell. Or you can always call or email me later if you have any questions. Report summary is this. The EPA has the authority to list unused pharmaceuticals as hazardous waste on the P or U list. EPA must explicitly list pharmaceuticals to regulate them as hazardous waste. EPA has not listed any pharmaceuticals as hazardous waste since 1980. We identified 8 specific pharmaceuticals that qualify as acute hazardous waste based on toxicity. EPA had proposed a universal waste rule for pharmaceuticals. It's currently reproposing the rule. It'll come out in some other form, probably not a universal waste rule. And then the last one, healthcare facilities may be unaware of existing federal and state hazardous pharmaceutical waste regulations. When I refer to hazardous pharmaceutical waste, hazardous waste pharmaceuticals, pharmaceuticals that are hazardous waste, that's basically pharmaceuticals that qualify as being listed as a hazardous waste, as opposed to the general term of pharmaceuticals, which I'll get into a definition in a second. For the report, this is our purpose: to evaluate EPA's process to identify and appropriately classify pharmaceuticals as hazardous waste to ensure their safe disposal. Questions we asked: do EPA's hazardous waste codes appropriately classify pharmaceuticals as hazardous waste? What process has EPA established to identify and list new pharmaceuticals as hazardous waste? What steps have states taken to identify and regulate additional pharmaceuticals as hazardous waste? On that standpoint, California is a very interesting story, again, which we can get into later. And the last one, how will the universal waste rule impact the management of hazardous waste pharmaceuticals? What's the current status of the rule? Some background. Pharmaceutical wastes have been found in surface, ground, and drinking water. Been found in treated wastewater effluent from POTWs. They've been found in streams, lakes, and groundwater, sediments, and fish tissue. USGS examined 139 streams across the country. They detected pharmaceutical compounds in 80% of those. Potential harmful effects on public health and the environment, some interference with human hormone development, and reproductive interference in aquatic species, which has included feminization of fish. Most, as you would expect, most pharmaceuticals would have some effect because the reason they exist is because they have some sort of a toxic effect. Normally that's dose dependent. So an example of that would be warfarin, which happens to be a listed hazardous waste. It's used as a blood thinner. Well, higher doses, it's also used as rat poison. EPA defines a pharmaceutical as any chemical product, vaccine, or allergenic not containing a radioactive component intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease or injury in humans or animals. They include expired drugs, personal medications, waste materials containing excess drugs, drugs that are intended to be discarded. Generators of hazardous waste pharmaceuticals include pharmacies, physicians and dentist offices, outpatient care centers, ambulatory healthcare services, residential care facilities, veterinary clinics, and reverse distributors. A little more discussion, again, later on, probably about some of the potential regulated facilities for some of these things. Important point I've mentioned, I'll mention it again, probably several times. RCRA doesn't regulate pharmaceuticals until they are discarded as a waste. Further, under the domestic sewage exclusion, healthcare facilities may dispose of hazardous waste pharmaceuticals, that's RCRA pharmaceuticals, down the drain. Now, that's not the case in California. California doesn't allow disposal of any hazardous waste down the drain. So, clear distinction there from a California perspective. Certainly an increased awareness of the problem illustrated by public take-back programs. I'm sure you've all either seen or participated in those or donated some to them perhaps. And this summary, I think, says it best. And these are just for personal care pharmaceuticals, not from a business perspective. But in 2012, DEA, state, local, and tribal law enforcement partners worked at more than 5,000 locations, collected almost 500,000 pounds of prescription medications from members of the public. Add that to all of their take-back events, and it's more than 2 million pounds removed from circulation. Definition of hazardous waste. I'll go into this briefly, certainly not in anywhere close to the detail that was in the class yesterday. They can be ignitable. Okay, and most of these are self-explanatory. They catch fire. They can be corrosive. They're acidic or basic. I think also if they dissolve steel in a certain period of time, they can be considered corrosive, but certainly in the class yesterday, they said they'd never seen that used you'd never seen a waste listed or considered hazardous because of that. Reactive, waste that blow stuff up or waste that blow up. And toxicity, waste likely to leach dangerous concentrations of toxic chemicals into the groundwater. There is a discrete list of things that are used for those toxicity measurements, not to be confused with acute hazardous waste that we'll go to, that are listed based on toxicity. There are lists of waste. The F list from industrial manufacturing processes, the K list from specific industries, then the ones that we're interested for this report, the P and U list. Hazardous waste, including specific unused chemicals. They can be listed on the U list based on toxicity or other characteristics. They can be listed on the P list if they're acutely toxic. P list chemicals are regulated when generated in lower quantities than U list chemicals. If you're a generator and you have a P list chemical, you are regulated as a large quantity generator if you generate more than 2.2 pounds in any calendar month. If it's a U list chemical, that's 2,200 pounds in any month. Back in the U list, I have no idea where F, K, U, and P came from, or if they ever meant anything. But it's everybody always refers to them, so you just kind of have to get used to it. You listed hazardous waste. EPA may list if it concludes the waste is capable of posing a substantial present or potential hazard to human health, or the environment when improperly treated, stored, transported, or disposed of, or otherwise managed, based on the following criteria, including these criteria. Nature of the toxicity presented by the constituent, concentration of the constituent in the waste, potential to migrate, persistence, bioaccumulation, or other factors. And one of the issues with this is it can be maybe not clear-cut, might be considered to be more subjective than the P listing simply because it can be subject to interpretation. In order to be listed either as a U or a P or any of the listings, they actually have to go through a regulatory process as well, which has public comment periods. So it's quite a lengthy process. Acute hazardous waste, it's P listed. It's simpler listing criteria than U listed waste. It's based on toxicity criteria, found to be fatal to humans in low doses or in the absence of human data, and these are the important things because they are more readily available, and it's pretty much of a bright line. The administrator can list these as hazardous waste if, excuse me, they have a rat oral LD50 less than 50 milligrams per kilogram, a rat inhalation lethal concentration 50 less than 2 milligrams per liter. If you're not familiar with LD50, that's lethal dose 50. It's the dose of a substance that will cause the death of 50% of a population of animals, in this case rats. In the old days, they actually used to use a population of rats. I think they're more sophisticated now. They still use animals, but they really use fewer of them than they used to. The LC50 is lethal concentration, 50. And there's other terms that don't appear here. Rabbit dermal LD50, less than 200 milligrams per kilogram, or otherwise capable of causing or significantly contributing to an increase in serious, irreversible, or incapacitating irreversible illness. And what I'd like to emphasize here, and the one that seems to be the most common and the one that we looked at a lot, was the rat oral LD50. It seems to be pretty available, and again, it's a pretty bright line designation of being able to be listed as P-waste. EPA published guidance on healthcare facilities. That was from the Office of Water in 2010. Best management practices for unused pharmaceuticals at healthcare facilities. URLs at the bottom. If you're in a CUPA or you're regulated, what's important about this particular document is it contains a list of the 31 pharmaceuticals that are currently considered hazardous waste. They are listed. So if you want to know what to look for that's hazardous waste, I list there, and I'll get to that if we can. The goal is to keep pharmaceuticals out of U.S. waters. It recommends best management practices to minimize releases of pharmaceuticals to the environment. I know you can't read this. That's in the document. It's on page 12. I've just highlighted two areas that I'm going to come up in the next slide. The first one, on the rectangle on the left side of that flow chart, if the pharmaceutical is listed on the NIOSH list. NIOSH is the National Institute of Occupational Safety and Health. They publish a drug list. I don't know if it's annually, but it's on a regular basis. They try to keep pace with the drugs that are available. And they define things as hazardous based on a set of criteria they have focused on things that could cause harm to people handling them. So it's more of an occupational perspective, but this list is used quite a bit as pharmaceuticals that be considered prospectively to be managed as waste. Okay, so EPA said in their guidance, the pharmaceutical listed on the NIOSH list, state regulations must be followed. If there aren't any state regulations, EPA recommends disposing as hazardous waste. So that's in bold. They haven't listed them as hazardous waste, but they still recommend disposing of them as hazardous waste. And a quote from the report, although RCRA doesn't require facilities to manage NIOSH-listed hazardous materials the same as RCRA hazardous waste, they recommend that those materials be managed using RCRA guidelines as a best management practice. Okay, they haven't listed them, but we'd like for you to go ahead and manage them that way anyway. Guidelines don't have any enforcement authority on them. They're just what they say, guidelines. Another quote, while not all chemotherapy pharmaceutical waste may be regulated hazardous under RCRA, EPA recommends that they can still consider them as hazardous waste as a best management practice. EPA had proposed a universal waste rule in 2005. Basically, universal waste streamlines requirements, some increased accumulation time, and I think reduced record keeping primarily. The comments were summarized in 2009. Due to substantial negative comments, EPA is not pursuing the rule as originally proposed. They stated they're currently developing a new proposal to establish appropriate standards for the management and disposal of hazardous waste pharmaceuticals generated by healthcare facilities. Their anticipated publication for public comment is August 2013. Okay, long quote here, but I think it's especially relevant from the state of Minnesota. The state of Minnesota differs from other states, except perhaps Washington, the way they regulate pharmaceuticals. You don't have to list in Minnesota. If you exceed toxicity criteria, you're hazardous waste, period, end of sentence. So they're a little different. Proliferation of pharmaceutical development since RCRA, coupled with the absence of any updates to the URP list, results in some extremely dangerous pharmaceuticals not being listed, while other pharmaceutical waste that's much less hazardous is regulated as acutely toxic waste. The fact that there's still no federal mandatory waste management regulation for most chemotherapy drugs is alarming. Encouraging healthcare facilities to manage NIOSH hazardous drugs as hazardous waste does not adequately address the danger. Okay. What we did, how we did it. We interviewed EPA headquarters program staff. We also analyzed a ton of data. Well, that's actually more at the bottom. We interviewed state program staff in 3 states, Minnesota, Washington, and California. There are a few other states that are more stringent than EPA in terms of pharmaceuticals, but the main ones, these are the ones we spoke with. We reviewed lists of EPA hazardous waste, NIOSH hazardous waste pharmaceutical drug alerts, and OSHA chemicals and carcinogens, as well as a ton of documents. NIOSH hazardous pharmaceuticals, I think there's supposed to be 157 of those, and I think there are 61 OSHA, and there is quite a bit of overlap. I think there's only about 10 OSHA that are not on the NIOSH list, and we looked at all those. We examined the toxicity of NIOSH and OSHA pharmaceuticals, and we actually looked at more than 250 total because we just threw some others in there out of curiosity. The way we looked at toxicity was at the National Library of Medicine website. I'll actually show you that later on. The advantage of that is that the data there are based on peer-reviewed scientific literature, and there is a link to the source that tells you where the toxicity information came from. It's also supposed to be available on MSDS sheets. We didn't have access to those, and actually we met with limited success in trying to obtain that information off MSDSs if we could find them on the internet. Again, we identified 8 pharmaceuticals that qualify as hazardous waste, as acute hazardous waste, sorry, big difference. Major findings we have. The EPA hasn't used its hazardous waste management authority. Many more drugs than EPA has identified may be hazardous. EPA initially identified 31 pharmaceutical chemicals meeting RCRA hazardous waste criteria and listed them. No pharmaceuticals have been listed since that time. Further, EPA has no process to identify and review pharmaceuticals that may qualify as hazardous waste. So not only have they not listed them, they don't have a mechanism to identify them and then examine them to see if they qualify as hazardous waste. And just in comparison to that, there are at least 30 new drugs available each year according to FDA since 1996. If I can do this without blowing the machine up. Let me see. wrong one. Be patient. Okay. Again, these are the pharmaceuticals from the 2010 draft guidance that are regulated that certainly would be of interest to you, I think, as a CUPA or a regulated facility. There are some that are P listed, and there are some that are U listed. If you're a quick counter, you'll see that even though I said there's 31, there's actually 32, and that's because warfarin is listed based on concentration, both on the P and the U list. So I think that, again, this list probably come in handy. It's in that report. Okay. Some unlisted drugs meet the RCRA listing criteria. Again, we examine the NIOSH and OSHA lists, obtain toxicity values. 8 drugs meet the EPA standards for acute hazardous waste, which is the one that we most commonly found is 50 milligram per kilogram rat oral LD50. Additionally, we found 21 drugs that are within the range of rat oral LD50 values that we found for U-listed waste, which is 50 to 500 milligram per kilogram. That's not a way that you can definitively list just on that criterion as a U-listed waste. As I mentioned earlier, there are other things that come into play. The whole reason we put that in the report and the whole reason we focus on it is it's just an example. We looked at U-listed waste and found out and took a look at their LD50s and said, okay, for the NIOSH list, how many of those meet the same criteria and are potentially also hazardous waste? Interestingly, we found 3 U-listed wastes that appear to qualify as acute hazardous waste based on toxicity. We also looked at all the toxicity from the P and the U list. These are the existing P list hazardous waste. That was also on the slide I showed you earlier. 8 of them. Interesting. And actually, for some of these, nitroglycerin, for example, clearly wasn't listed based on its LD50. And some of these we couldn't find a rat oral LD50. For the ones that meet it, again, there's 8 of these. I'll probably mispronounce them if I go through them, but some of the LD50s are fairly low, 7.2, and these are all under 50. So these meet a fairly simple, as I always refer to as a bright line criteria for listing. You should be able to list these according to the regulation without any problem. Healthcare facilities may be unaware of their RCRA obligations. According to the EPA, this is in their cost-benefit analysis from the Universal Waste Rule. They say many healthcare facilities have been unable to comply with the RCRA hazardous waste regulations as they relate to hazardous pharmaceutical wastes and often manage these wastes improperly. Generators of pharmaceutical hazardous waste may be unfamiliar with RCRA, resulting in improper disposal as municipal waste. And that's been confirmed by outreach efforts in Minnesota and Washington and enforcement efforts in EPA Region 1 and 2. And especially the EPA efforts are only focused on the small number, the 31 pharmaceuticals that are listed as hazardous waste because they don't regulate the others. EPA is developing, as I said, a new rulemaking. The initial rules proposed in 2008. They decided not to proceed after a view of comments. Not an enormous number of comments. There was the existing coal ash rule, I think. It has to do with classification of coal ash as hazardous or non-hazardous waste. Got like 500,000 comments, something along there. So they got about 100. But they included concerns about lack of notification and tracking requirements for universal waste. And they also indicated concerns by generators of a change in their status and how they make hazardous waste determinations. as some of the comments also did include the one I had from Minnesota, and they were fairly clear, I think, in their opinion. EPA stated they began developing a new proposal for the healthcare industry in 2010. They have stated on the Universal Waste website that public comment on the proposal is anticipated spring 2013, as I mentioned. The Universal Waste website, which I would have given you a link to, no longer exists. They have a new proposed rule website that states public comment anticipated in August 2013. I think that also has the original Universal Waste proposal because it has some interesting reference information in it, in case you're interested. Recommendations. We recommend Assistant Administrator for Solid Waste and Emergency Response identify and review existing pharmaceuticals to determine whether they qualify for regulation as hazardous waste. EPA agreed with this recommendation. They have had a contractor doing something similar to what we did, and we actually shared our list with them. So they're certainly aware of that. EPA has, that's the next one, they've completed their limited research effort to identify pharmaceuticals for possible listing. Possible next steps include initiating rulemaking or collecting additional data. Next steps to be identified by December 2012. Notice that date's passed. EPA has actually stated that they've done that. I haven't seen them, and I don't think they're under any obligation to publish this. Recommendation number 2, to establish a process to review new pharmaceuticals to determine whether they qualify for regulation as hazardous waste. EPA agreed with this recommendation. They will consider how to review pharmaceuticals by December 31st, 2012. Same date, same thing. They've said they've done it. I haven't seen it yet. Third recommendation, develop a nationally consistent outreach and compliance assistance plan to help states address challenges that healthcare facilities and others as needed have in complying with RCRA regulations for managing hazardous waste pharmaceuticals. EPA agreed with the recommendation. It's addressed in 3 phases. Continue ongoing outreach and compliance assistance. Propose revisions to RCRA regs to more effectively address hazardous waste pharmaceuticals in the healthcare sector. Again, that's included in their anticipated rule. And develop a communications plan detailing outreach efforts to implement the new regulations. Now, they say that to be developed as the part of the final rule package. Any questions?
Yeah. If you look at California regulations, basically they gutted all the hazardous waste regulations for the pharmaceuticals that are non-RCRA. Then they took it a step further recently where they can send it all to a reverse distributor out of state. They can decide what to do with it. Then that reverse distributor can take expired drugs, repackage it, and sell it. So it's out of control.
Is this related to California specifically? California right. Specific. Diana, I don't know if that's all the hazardous waste regulations for the non-RCRA right. Pharmaceuticals. And we can talk about that. It's certainly not anything that I would necessarily have a formal opinion on or be able to state since I'm with the federal government. But
you're doing the same thing at a federal level. It's just a matter of time.
Right. What is again? We'll talk about this in a few minutes. Including, we can also talk about reverse distribution, because concept of reverse distribution is if you send something back to the manufacturer, that's okay. It's basically recycling. They can reuse it. Now, I don't understand how an off-spec pharmaceutical can reuse.
Distributions, they don't have to send it back to the original manufacturer.
Okay.
They can send it back to any manufacturer they like.
Right. And I think there are, I was in a discussion like yesterday and someone pointed out that, yeah, the pharmaceuticals may be off-spec, but whoever they send them back to will get money back for them because they will sell them out of country. And from that perspective, if there is a value to the retailer or wholesaler sending it back, then under EPA, it probably isn't going to be considered a waste.
They can still sell it in the United States now. That's become legal through the FDA. They can re-extend the expiration date.
But they have to test it.
Yeah.
It's not. see as far as pharmaceutical regulation on different pharmaceuticals? Federal level.
From an EPA's perspective, and that's our focus, is hazardous waste, the only way they're going to regulate non-RCRA as hazardous waste is if they list it as a hazardous waste.
But about maybe amending the solid waste law to include medical waste, I guess.
I don't know about that. Medical waste is not something I have a lot of knowledge of, other than the fact that it seems like EPA washed its hands of anything to do with medical waste sometime in the late 80s or early 90s, and entirely deferred that to state level. So, yeah.
It seemed to me that in looking at the program as a whole, the focus really was on the methodology for including newly developed pharmaceuticals into the existing framework of RCRA.
Mm-hmm.
Is there any discussion beyond the final recommendation of, hey, you need to look at how you go about identifying potentially hazardous pharmaceuticals to extend to maybe the criteria by which determining toxicity with respect to pharmaceuticals, given the whole idea that 80% of the pharmaceuticals, 80% of the streams of the sample ended up with pharmaceuticals. It didn't say 80% ended up with pharmaceuticals. Was there any discussion at all to addressing at the federal level how we go about determining toxicity?
You're basically asking, has there been any look at changing the regulations or the statute? Okay, certainly some opinions on that. Changing regulation for something like that, if it is just regulatory, a regulation certainly is, it's not out of the question, but it would certainly, it would take a while. Changing the statute is something that would certainly have an effect, but that's certainly not something that's out of our scope in terms of saying, make a recommendation of change of statute. You're almost never going to, I think probably never going to see that in an IG recommendation, again, because it's not our job. Just in passing, I meant to say this, that the whole reason we got here, a lot of our projects start based on something that we uncover in a prior project. We want to get our projects done in a year, so we're pretty stringent on how we limit the scope, so we know we can get it done in a year. If there's other things that need to be addressed, we'll set them aside, we'll propose them, and then we'll look at them next year. That's how this got started. We were looking at EPA's implementation of the meth lab statute. And one of the things that we were looking at was how EPA looks at remediated meth labs in terms of household hazardous waste. Most states, or a lot of states, I think California's included, do not consider waste from a meth lab to be household hazardous waste, and then you can send it to a landfill. So they manage it as hazardous waste. At least and I think it's a practice in other states. But other states do not. And as a part of the discussion, we were talking with some people at EPA in the RCRA program, and he said, okay, hey, we don't know the answer to this. Is methamphetamine a hazardous waste? And kind of smiled and said, well, no. And because it's never been listed. And nothing new has been listed since 1980. So we kind of said, thank you very much. We think we know where our next project is.
It seems to me that the revision of the regulation could be fairly quickly
Right.
Done by certain.
I agree with that. And certainly you might see some of that coming, but again, the regulation has to be consistent with the statute. You can't go beyond it. Now, one of the things that I've observed, certainly in my opinion, that a lot of state programs, a lot of federal programs, at least in the early days, came into being because they were modeled after successful state programs. Minnesota, which we can talk about in a little bit, again, has an entirely different approach. So.
the FDA should be a part of this whole process. That when they're getting these drugs approved, could they not find out what the toxicity of these drugs are? So all this work doesn't have to be done on the back end of things?
They certainly could. We did ask EPA that. They said, I don't remember the exact, their exact response was that they had limited success in obtaining information from FDA. Now, I thought at one time, well, this is a pharmaceuticals, a new chemical, so is it going to come under TSCA? If it comes under TSCA, then there should be data we can get. But it doesn't, it's as you said, it comes from FDA. We did get one of our LD50s from there, by the way. That was more by luck than anything else. Yeah.
A couple of comments. I mean, one is the vast majority, first of the 31 compounds dropped on the list, plus the vast majority of other items are not. These are not things that are found in retail situations, and in many cases, they're not in compounding pharmacies. They're healthcare facilities. This is how I don't know if you got any friends that went through chemotherapy or stuff like this. This is how we kill off cancer cells, and the problem is the disposal in the healthcare facility. Second comment is that when you look at these studies that say we have pharmaceuticals in the water, what we have is stuff that's probably not all that amazingly toxic. We have stuff that's we have testosterone, we have estrogen, we have Valium, we have these types of things. These don't meet toxicity. They may not even meet California's hazardous waste non-RCRA. So there are two separate conversations. There's a RCRA conversation that addresses healthcare facilities and pharmaceutical retailers and wholesalers, and there's a conversation about how we treat our water in the United States. And we can't conflate the two questions. Where, stuff that goes to landfills in the United States, the vast majority of Subtitle D landfills have leachate collection systems. That leachate is then tested and then it's processed in what? A wastewater treatment facility under a NPDES discharge permit. It is a water issue. It's not necessarily a hazardous waste issue.
Yeah, there's at least two potential control issues in the last thing you mentioned, because municipal landfills are solid line, not double line. So the question, that's the whole reason for not putting hazardous waste in a municipal landfill. And then there's the issue of POTWs and how tightly that's controlled. And actually that is on one of our planned projects coming up. So there may be more to come on that. I understand your comments. So in the whole perspective of if something qualifies as hazardous waste, that it should meet more stringent management standards. I don't think anybody's saying that pharmaceuticals are going to end up being in the water in the same concentration and have the same effects as if you'd be treated by them. But they can have unforeseen effects on the environment. So like feminization of fish, it doesn't seem like a natural occurrence to me. So.
I don't think anyone here is going to argue that it's the mass dumping of pharmaceuticals as the sole source of estrogen and testosterone in the swim. A lot of that's overdose of gas. But,
right.
As regulators, I think most of us are going to err far on the side of safety and
there is a healthcare facility issue, certainly, and I've got some numbers that I can throw up on there in terms of potential number of health facilities in California and how many of them look like they're regulated by RCRA. The numbers don't look to me like they match. So from that perspective, does that mean that they're not being regulated appropriately? So, yeah.
Do you need like a Clean Water Act? I should warn you, I look around this room, I see a lot of people have been looking at this issue for 10 to 20 years and studying it, but I know RCRA doesn't, but with any of the federal laws that capture the quality of the purview of EPA, capture antibiotics, obviously I think everybody knows they're not at all toxic to mammals, but they're a real public health threat in that, antibiotic-resistant bacteria arguably could be, well, I think it would be a strong argument that it puts us at risk much more so than any RCRA hazardous waste as a population. But any federal law that could conceivably reach that, or would that be the legislature?
Good question. I don't know the answer to that. When you start looking at chemical lists, initially you can't find any, and then you find too many. And you can't figure out what they're used for. I'm looking at some of that now relative to water program. But I don't know offhand. For example, a merger between the NIOSH and are there any on NIOSH that are not on the RCRA list, or could be easily on the RCRA list that are on one of the water program lists? I don't know. We may be able to look at some of this if we get a chance. So I've got a couple of lists I can bore you with.
Well,
Yeah. Yes.
So one of the big frustrations that we have, I'm with Sandy about that. One of the big, we just had a pharmaceutical workshop in a lot of our companies that are in our county. And the big source of frustration that the healthcare industry has is that they are regulated by, in the state of California, 3 different
Right.
regulations. The DEA, the controlled
Right.
substances, and then RCRA and us as far as hazardous waste, but then the California medical waste.
Right.
And we're all getting conflicting information on what the proper disposal is, and the whole drug diversion. So we'd like to actually get to a point where we can give them a clear, unified answer across all the agencies. And I'm just wondering how far away, or if we're ever going to be able to give them an answer that is clear, concise, and consistent.
Good question. I'd actually run that up through the existing CUPA infrastructure as something you'd like to have addressed. From our perspective, as California Medical Waste, it's not something that we're going to be able to certainly do anything about. But from just what you described, it seems to me, in my opinion, that you've got 3 fairly discrete lists. Controlled substances, which DA is going to have the last say on one way or the other, right? They have to. Pharmaceuticals that are listed as hazardous waste are managed as RCRA, period. And then the last one, medical, everything else. So from that perspective, it seems like there may not be overlap in the list of things that are managed. So I certainly understand how there's confusion. And anything I've seen that any other states or regions have done in terms of healthcare facilities, it's been a real issue. Go back to the early days of hazardous waste generation, and hazardous waste generators didn't think they were generators. I'm not a hazardous waste generator, I'm just a business. So there was a lack of understanding of that, and unfortunately I think healthcare facilities are still in that situation. Most hazardous waste generators, of course, aren't, but healthcare facilities seem to have be in that situation. Yeah.
You have to look at it, the healthcare facilities, companies, they helped change the law. It wasn't the regulators that changed the law from hazardous waste to medical waste. That was done on purpose. So for them to say all of a sudden we didn't know that this was in this universe is ridiculous, because they did not want to be in hazardous waste regulations because of the penalties and the felonies. And they were getting nipped on that, so they changed the law. So the idea that they don't have knowledge, maybe at the store level, but at a bigger level, they have full knowledge.
Interesting perspective, because of that. On if you look at Minnesota lethality characteristic, oral LD50 for rats less than 500 milligrams per kilogram, order of magnitude higher than RCRA listing as acute hazardous waste. Dermal LD50 less than 1,000, inhalation LC50, inhalation for rat and for dust and mist, and separate one for gases and vapors. Major point is that they don't use these criteria to list. This is a characteristic for them in terms of how they define hazardous waste. It's up to the generator to understand what's there from MSDS or other sources. Again, definitions based on toxicity, not on listing, and the LD50 is higher. Big difference. Other states use different criteria. Washington, similar to Minnesota. Of course, it's going to be different, but it's similar in general. California, similar to Minnesota, with the exception that non-RCRA pharmaceuticals are not managed as hazardous waste. They're medical waste. But they do have the same, if you look at the hazardous waste definition in California, it's similar to Minnesota. There's a set of criteria that say if you exceed this toxicity, you're hazardous waste. It doesn't say you have to be listed. And there's other states as well, Michigan, New Jersey, North Carolina, Rhode Island. A lot of them do it in a listing process. See if there's anything else you need to see. Again, and I'll put certainly parts of this second presentation out in the meeting stuff as well, so you can actually get this table if you want. But again, it's in the 2010 draft guidance. Back to definition of hazardous waste with a toxicity characteristic. These are TCLP wastes, and again, these are easy to find. They should be easy to find. They're not as easy as they should be. But this is a list of them, and where I got this list from was the publication on the left. It's an EPA publication, hazardous waste identification. Probably not a bad idea for you to get a copy of that. You can also find some information in the RCRA orientation manual, which is significantly longer and more complicated and probably won't address some of the issues that you deal with. You guys want to keep going? You want to take a 5-minute break? Does anybody ever not say break?
You need a break?
No, I'm good. You guys want to keep going? Can we get out early? Okay. Let me see if I can break out of here and show you what we did. Let me get rid of my favorites so I don't embarrass myself. This is a National Library of Medicine site. If you're ever looking for an LD50 or information on a chemical, I suggest you go here. Its URL will be in the presentation materials. So you can select your substance by name, by registry number. Registry number is Chemical Abstract Society, or CAS number. If you're not familiar with it, you'll run into it time and time again. You can use it to match and merge lists fairly simply. So let's just back to the Myosin. What you get then is another page that comes up, and if you are interested in the chemical structure, well, there it is. But the important information you're going to see is on the left-hand side. First of all, they have information on synonyms, and that can be really important to you because people can refer, you probably run into this already. You know, chemicals are known by different names. I'm sure pharmaceuticals are the same way. Toxicity is an active button, and that will bring up a whole new screen. And this is live, by the way, if you couldn't tell that already. And this gives you everything you wanted to know about any literature that's been done. And in this case, I'm sure you can't read it. It's hard for me to read. But the bottom line here is, they've got information on birds, cats, dogs, guinea pigs, hamsters, humans, mice. And they have intraperitoneal, they have oral, they have intravenous, etc. And then they've got 4 on rat. And the rat oral we found on this, for this substance, for dactynomycin, was 7.2 milligrams per kilogram. So does it meet acute hazardous waste listing criteria? Yes, it does. Anyway, that's something you might want to use if you're interested in toxicity. Mm-hmm. This is basically just screenshots of the same thing. Again, toxicity values on multiple animals, and oral LD50 is 7.2. When we looked at another one, and the reason we work in fairly small teams in our projects. For this one, I think I had a total team of 4. We had quite a few chemicals to go through, so we tend to split them up. And to the extent people could, they do any kind of search other than National Library of Medicine. But certainly that was what we used because it seemed to be fairly standard. And on there is a hot link on any of the toxicity values that will take you back to scientific publication. So again, it's peer-reviewed data. And we did find on vinarobium tartrate through a Google query. Who knows what? I think MSDS, LD50, and then with a chemical name, and we came up with one that had a rad LD50 of 26 milligrams per kilogram. So that's another possible option. If you have access to MSDS, you can get it there. The other one we found was colchicine. As I understand colchicine, it's basically, I think it's used for gout treatment. I knew from just some lab work in the past, I mean, it's a cellular poison, so I couldn't see why this wouldn't be fairly highly toxic. I ended up finding something in an abstract that was publicly available at FDA. Any toxicity information at FDA that they analyze is probably not going to be publicly available. But in this case, even though it wasn't what they were necessarily looking for, they were looking at differences between sensitivity in males and females. They did find that female rats were significantly more, they found that the LD50 was 26 for females and 48 for males. In both cases, still below 50. So it qualifies as an acute hazardous waste. Pharmaceutical waste in California. Again, this is P-listed waste. Should be, at least. But it's based on California Waste Code. Diana, you can feel free to jump in anytime you need.
We have California Waste Code before.
You do. We'll get there in 1 second. This site is available at the URL here. This is a public site. If you get a log on, you can find some other report information. I don't think that anyone can log in to this to get a log on. I'm not 100% sure of that.
They're vetted out by the state, so you have to prove that you're a regulator.
Right. Well, obviously I have access, so you have to be a regulator to get it.
I think you can look at your own facility, for instance, for grocery.
Yeah, but this report, that's the report competitive enforcement report, so that's a regulator level.
So you know all those. Well, yeah, I mean, with the data you have at DTSC, you can dig down and actually get an image of the manifest if you want to go that far. So I was curious, so I pulled up one of the regulated reports, which is 311 Pharmaceutical Waste for 2011, and wanted to see generators. Results, 1,500 tons total, 2011. Now, it's not a lot compared to California's total, but still. 3,627 businesses, wide range of annual volume per generator, from a pound, or and a lot of those down in the lower ranges, to 278 tons. 278, I think, is from a TSD. That's probably shipping it elsewhere. Did a simple query. If it's there, I couldn't find it in HWTS of anything based on the NAICS code to do a business type search. That typically has its own set of problems anyway. But did find 178 of these were probably hospitals, and at least 2,000 of them were pharmacies based on name. And that was not rigorous. That was just what was on the top of my head for what I thought were pharmacies. So I just searched CXL. It came out. Another report you may be interested in, unused pharmaceuticals in the healthcare industry. They have one slide here that seems like it's got a fairly low number to me. Its number of healthcare facilities in 2005, I think it's a total of about 50,000. I'm just giving you some sort of indication what the ballpark looks like. Regulated hospitals in California. I was curious about that. I don't know if any of you have ever been to EPA Envirofax. If you like, I can take you there now. But this is what it's like if you go to their website and then you click on the waste button. Then there are various areas you can look at under waste. You can look at Circulus, which you probably don't want to do because that's Superfund sites. You can look at BR, which is a biennial report. Any federal generator or disposal facility has to file that every 2 years. Generator only if you're a large quantity generator. And RCRA info, generators, transporters, TSDs that are regulated at the federal level. I did a simple search in RCRA info. State of California, anything beginning with NAICS 622, which is defined as hospitals. California, 2011, 80 large quantity generators, 146 small quantity generators. Total number of hospitals, I'll get to in a minute, is larger than that. If you look at by any report, again, large quantity generators only. Federal waste, again, same NACI S code, and these reports take a god-awful long time to run. 2011, waste generated on site, again, only LQG's file, only found 52. Compared to that, there's 80 large quantity generators, 50 filed. It doesn't mean that some of them didn't have, missed filing, because a lot of businesses will protectively file as LQGs just in case they happen to exceed the minimum requirements during the year, so they don't get tagged for that. At least that's the way it used to be. Okay, so RCRA info, 226 generators in 622, 52 filers in the biennial report. Other internet queries, around 400 hospitals in California. A lot of different sources. I just found with a simple query, another one later. About 6,300 licensed pharmacies. If you look for pharmacies, let me see, 129 of these were LQGs, 28 SQGs, 428 CE SQGs. This would be from RCRA info. And then one biennial report file as a pharmacy. So lower numbers than the totals. What's that mean? I don't know. Just giving you some information. If you get data from the census, that's another fun place to go and try to find your way around. But you can query by state. And this is 2007 data. In ACI 44611, which is pharmacies, 4,353 of them in California. Different number than we saw before, still a lot of them. And I don't know if you can get lists from these or just totals. The other sources you can probably get lists from. You can. I know you get lists from them. For hospitals in 2007, I said it was around 400 earlier. If you look at the NAICS for 622, there's 455 of those. So again, smaller number than the ones that report. This information I'll throw out in the. I won't go on until you're done writing. So I'm always fairly curious about data like this, looking at one place and then another. Okay. Now you've seen this, so you need to see that. Seen that. This is how we did our work. Well, just from if you really are serious about chemical lists and what's regulated, EPA has a list of lists. It's available in Excel. It's integrated based to the degree that it can be on CAS number. You've got to be really careful with CAS numbers. Some people use them with dashes, some people don't, and so it can be hard to match them. And there may not be universal agreement on what they are, but it's usually pretty good. So we imported data from the list of lists, and that was EPA had carcinogens. They had the 302 list, CERCLA, the 313 or the TRI list, the 112R or the RMP. Is that the same as ARP? You guys have an equivalent to RMP, do you not? It's different? Okay. It's larger. What's the acronym for it? No, for the RMP. ARP? Okay, so I was right. All right. And so we found those. We also found, out of curiosity, endocrine disruptors, CCL3 list, which is a list of potential groundwater contaminants, which may address your issue a little bit. And associated with that in the EPA list of lists, they also have the P or the U code. They actually have the hazardous waste codes. So from our perspective, it's a P or U code. We were then also able to obtain the NIOSH list and the OSHA list. And then we were able to the extent that we could, integrate those on CAS number, which is about as much fun as it sounds like it would be. It doesn't have to be manual. You can automate it to a degree, but it's not the easiest thing in the world. And then we looked at the rat oral LD50 and made notes on other things we could find. And the ones in yellow on the right are the ones that I already told you about. That's where we found the LD50 information. The interesting thing about the list of lists, and we've expanded it a little bit, is that you can tell where a chemical is regulated by more than one program that may be useful to you. And again, then if you go down here, you see there are other rat oral LD50s that are higher but are still potentially problematic. Any other questions? Diana, you have anything you'd like to?
I have a question.
Okay.
So for warfarin, you listed if it's greater than 0.3%, you listed if it's less than 0.3%. So given the November 2011 letter that the FDA came out with in terms of guidance for empty containers, it didn't seem like it was very helpful to determine whether or not P-listed empty container could go in the trash. Is EPA going to come out with any further guidance on, I mean, I think everybody's just managing on these empty containers.
Do you hear the question? So it's, yeah, my understanding on that is what, if you triple rinse them, the containers are okay?
Well, it's a P-listed container, or you use an alternative method. But they say that, you know, it's only P-listed if the residue in the container meets the P-listing, you know, greater than 0.3%. How would you know? You know, take the light, and then you have to run it, and you have to factor out that weight of the container, whether or not
Right.
you have the residue,
Right.
filler, or
Good question. I don't have an answer. The only observation I would make on that is if the letter is guidance, it's just guidance. And most EPA guidance is not only just guidance, almost all of it is draft guidance. So that makes it, I guess, even less enforceable if that's possible. Yeah.
I'd like to say something on that. I think the main point of that, in terms of helping generators, was focusing just on, regardless of whether it's P or U, the only thing that counts to a regenerator status is the weight of the residue.
not the
And
residue
that
container.
stops you from becoming an empty by just having empty containers. I think that's...
I did ask a question to Charles Corcoran and Diane as well on California medical waste, because again, California has specific toxicity criteria that would qualify you as hazardous waste even if you're non-RCRA. But if you're non-RCRA, you're not regulated as hazardous waste, you're regulated as medical waste. So the question I had was, well, okay, even if you're regulated as hazardous waste, you would have met the or as medical waste, you would have met the definition for hazardous waste, so does your accumulation volume count towards your generator status? And the answer was no. So at least it's simpler from that perspective, not making a comment on how appropriate it is, but it's certainly simpler from that perspective. Yeah.
To address Diana's concern, the Southern California hazardous waste guide right now is considering putting together a proposal for grant to go out and do testing, representative sample testing to answer just that question.
But we won't say, we can only say it's data unless you decide to act on it. You know? We can only say it's useful information.
Right. Okay. Any other questions?
Thoughts are good.
Okay. Thank you. I'll be up here if any of you have any questions. Otherwise, I think it's early lunch. Thanks.